Does diet helps to fix your teeth cavities and gum bleeding issues? Hello everyone, I am Dr. Padmini Hari and welcome to Indontics. Just because you are taking more supplements of calcium or vitamin C doesn't help to fix your teeth cavities or gum issues, Andy. Allowed to do. So you should always understand why actually what is the process of how tooth cavity happens. As we all tell you that don't take lot of sugary stuff or sticky food because that can get stuck into the grooves and pits of the tooth that will stay there for a long period of time, especially when it is not even washed out by saliva. Then the bacteria will come into the area, will secrete some acid and dissolve the enamel and breaks down the enamel into a cavity. So this is how the process happens. So there are so many interplay of factors, be it how deep your grooves of the teeth are, or how much flow of saliva you have, how thick or viscous your saliva is, or what kind of food you are eating, or how sticky the food is, and also how meticulously you are brushing or rinsing after eating this kind of sugary stuff. So there are so many interplay of the factors that can lead to actual formation of a cavity. Now, just because you have taken some calcium, it doesn't really help. Okay, so some amount of calcium which is generally good enough is what you are taking on a balanced diet, that is good enough for formation of a naturally healthy teeth. Calcium especially is important during the formative stages of the tooth, like whether the baby is in the mother's womb or during the formative stages where children generally drink milk and all that is good enough. You don't need to top up extra more calcium at that phase. Okay. Now, once a tooth cavity forms, by taking calcium, it doesn't help to relieve the cavities. You need to go to a dentist, they'll clean the cavity, they do a filling or restoration and fix it. Okay. Now, similarly for the gum bleeding also, gum bleeding, why it happens? The gum bleeding happens because if you don't brush your teeth in all the surfaces properly, tartar or plaque gets built up eventually along with a lot of bacteria inside that can cause irritation to the gums and inflammation leading to gum bleeding. Right? So this kind of deposit sometimes becomes very hard and that cannot be cleaned by your brush, so that you need to visit your dentist, get a regular cleaning or scaling done, and after that within 10-15 days it gets settled also. It's a simple issue, right? Whatever gum bleeding generally you people hear about caused due to the vitamin C, that is very rare, not very often you see that, but that can happen with a very severity also. If vitamin C deficiency is causing gum issues, that means there is a spontaneous bleeding, there will be severe enlargement of the gums, or there are some other issues also. Routinely what you are seeing is not because of the vitamin C. Okay, so make sure that for babies also, I just have to tell the feeding mothers, we see often when babies usually get up in the sleep a lot of times when the few teeth are there in the mouth, right? At that phase, like 1 year plus and all, when their babies are feeding, we call something called as nursing caries, which is often seen usually in the upper front teeth. This happens because they keep drinking milk multiple times during all the sleep. Please make sure that you are wiping with water after you are feeding the babies. Even after that, some kids who are going school and all that, they also have a habit of drinking milk or some kind of juices or any sugary stuff or fluid before bed. So that is not advisable. After, if you want to have milk during the bedtime, please make sure you are rinsing or washing or brushing at least that. Okay, because in the night time salivary action is very minimal and that can cause more cavities. Do visit Indontics for more updates on your oral health care. Thank you.